If you're a health professional feeling limited by the confines of those four clinic walls, but skeptical about online coaching, virtual coaching, you are going to love my interview with pelvic health expert Henny Ng, who has shown that she gets even more transformative results and can work deeper with people in her virtual practice. And we're going to talk all about that. Please welcome Henny Ng. Welcome.
Thank you, Dr. Shaunna.
Well, Henny, tell us a little bit about your background. You have a vast professional and personal background. So tell us what you were doing before you became what we call a health coach, and you're currently working also in that clinical role. But tell us about your experience. What do you do?
Yeah, I've been working as a physical therapist for the past 15 years across many different settings, including hospital, community, and clinics. And I've supported women from recovering surgery, rebuild their strength and mobility, and regaining independence and confidence. But over time, I start to notice that pattern, especially among women. And also from my clinical practice, I've learned that pelvic health is one of the most overlooked area of women's health, especially for moms. And so many women put their own needs last because of the pressure of doing it all to bounce back quickly, to look like they have everything all together. But between work, home, family demands, there's often very little space left for their own healing. And that's why that inspired me to go beyond traditional physical therapy practice and to explore women's health further.
And so tell me a little bit about this. So you're a pelvic health therapist, and you're working in this, and you're saying, hey, this is an area that's overlooked. And then this whole avenue became very personal. So tell us a little bit about why there was limits in what you could do in clinic and how you can help people more when we dive deeper into these other aspects virtually. So tell us a little bit about your personal story there that had you get, um, because as a physiotherapist, correct me if I'm wrong, you weren't only in pelvic health. It was everything, but the pelvic health is really what stood out. And now you are now a pelvic health expert. Is that correct?
Yeah, when people ask me why I become a pelvic health coach, the honest answer is because I lived it and I know what it's like to look strong on the outside and quietly struggling inside. And when I say I lived it, I meant personally, I experienced the struggle so many women face, like postpartum recovery, pelvic floor weakness, chronic pain, fatigue, and feeling disconnected from my body. I felt the pressure to bounce back quickly, just like many clients that I have seen, and even like when my body and mind were telling me the other way.
Yeah, and so I think a lot of people are expected to, a lot of women feel that same pressure. And so you had this pelvic pressure, that this heaviness and that okay, tell us a little bit more about that and some of those things that you were struggling with and then what became kind of the last straw for you.
Yeah, so like as physical therapists, people think that we have all figured out. But the truth, really, I was struggling postpartum. And I was running on empty, juggling with childcare, patient care, and work, and trying to be everything for everybody. My body didn't feel like mine anymore. My core felt weak, and I had leaks. Every time I laughed and sneezed, my back was aching constantly because of the long time sitting or standing, that I was not doing enough exercise myself. And I had this heavy dragging pressure that no one really talks about. But really, the most challenging thing, it wasn't just the physical symptoms, but it was really the feeling of me losing myself and feeling that I'm not worthy anymore. And I felt that that I lost my energy, I lost my confidence, I lost that sense of wholeness that I used to feel. On one particular day that I remember, on a very, very busy clinic work day, I just felt like, oh, my heart was racing because I'm constantly running one page after the other.
Mhm.
And I'm constantly looking after other people and not just myself. And I felt completely exhausted. And my body said, oh, I had enough. I have to take a break. And that's when I hit my rock bottom moment. And I remember thinking, how can I look after other people if I'm not even honoring my own body? And that was really the wake up call.
And I think a lot of women can relate to that. I mean, and picture, how old was your baby at this time?
I actually, my son was actually two times in my life I have experienced it. This is just not just
Yeah.
one time.
Yeah.
When I first returned to work after, uh, like after maternity leave, when
Yeah.
kids were both like between 1 to 2,
Yeah.
and I had to struggle with childcare, constant illness, and I have to look after them at nighttime,
Yeah.
and then in the morning without sleep, I have to go to the clinic to
Yeah.
work look after my clients.
Yeah, I
Yeah,
think a lot of moms out there, working moms out there can relate to that. And especially, and if you're in healthcare, like Henny is, you know what that's like. Like you're destroying your health while you try to help people be healthy. It becomes like kind of like ridiculous when you zoom out a little bit, but we do it because we kind of get trapped in this thing and you're go, 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 and you have this area of expertise and it's your job and that's what you're supposed to do. And so whether you're a nurse or a doctor or a physio or an OT where you're giving like this, but then if you are also a new mom, um it's a lot. Like your body has been through a lot, but I think, and we can talk in a little bit about that. People don't really give you the space to like heal from that ordeal. And especially if you've had something on a little bit more traumatic and where there's not everybody has the pelvic health challenges that you had through childbirth. Um, but many people do, and then people don't want to even talk about it because they're embarrassed about bladder leaks or like how do you know? And then you're kind of suffering in silence. And then so then there's this moment where on the one hand, you're supposed to be the person who's helping people with their pelvic health and doing all these things. And in the meantime, you're just kind of dying and you're just like your heart is racing, you're utterly exhausted, you can't go on, and you're like, that's it, like this is not working. Okay, so then, and so enough, you've got all the certifications, enough about pelvic health, you've got that book knowledge. Tell us a little bit what had you go and expand to get on the other side of us. Okay, this can't go on. So then what did you do that turned this ship around?
yeah. So I teach my patients to do the exercise. I know the core exercise progression. I know how they can recover, you know, physically. But what was actually missing was the bigger picture. So I had to return to the fundamentals of really connecting with their stress level and the emotions and also the gut health and nervous system. And not just looking at the physical part of the body, but actually to look at the person as a whole, holistic lens. And that really changed everything.
And that's where we're starting to cross over into, as I talked about at the beginning, in a busy, fast clinic, we kind of have to just do that physical thing that we do. That's our job. But there's a whole other side where the holistic healing comes in that gets those next level excellent results for yourself in this case, but then for your patients as well, which kind of is like, oh, this is even better. So I really carry on, carry on with your story.
Since that rock bottom moment, I started to go back to the fundamental of breath work, mindful movement, and nervous system reset. And I listened to my body instead of just pushing through. I built small, sustainable habits that fit into my busy schedule as a mom of two, and I really take it slow, and I practice self-compassion rather than just having this constant busy schedule on me. And gradually, my back pain eased, my leaks is also reduced, And also my strength came back and I felt less pressure over my pelvic area and I have less pelvic pain. But more importantly, it's not just the symptoms, but it is really the sense of confidence and the sense of calm that I felt I'm reconnected to about my body and I felt peaceful and more powerful that I'm back to myself.
Wow. I love that story. And like the gift you got on the other side of that hardship was even better than just out of pelvic pain, for example. Like the gift was so much better. It was your entire life. And so who are you passionate about helping now? I know that you have, this has completely transformed your life, both physically, but and personally, but then also professionally. So who are you passionate about helping now, Henny?
Yeah, so because living through this challenge gave me an insider perspective, I didn't just study from textbook about pelvic health because I lived it day to day
Yeah.
and learning like what is really truly works in a busy schedule. And because going through that experience gave me a more sense of empathy for women that I work with. So I really so it becomes my mission to help busy professional working mom to move from pain to resilience, from exhaustion to vitality, and to reclaim the strength, confidence, and joy. Because when we listen to our body with compassion, our transformation will happen.
And I love that you've taken up the charge of pelvic health because, as you say, it's so often overlooked. There's people doing heart disease and there's people doing this, but like there's not that many people focused on pelvic health. And a lot of people are not yet talking about it, and yet many women are impacted by it. And as your own personal story, which now, like when we look in retrospect, it was so meant to be that you had to go through that so you can pave the way to make it easier for others, so that they can know it's not just this. And so then that had you branch out to be a health coach helping these women with their pelvic health. And so then that also introduced this whole concept of clinic, um, and then an online aspect. And so where you can work with people beyond the clinic walls. And what else can we do? How else can we help them more deeply doing the breath work and the mindset work and the stress relief and all of the other things that it just takes a little bit more time, but the result that you get is so worth it. And it's allowing that person to do that for themselves. So as you embark on this health coaching, as you embarked on this pelvic health coach path, what do you love best about that way of helping people and transforming their lives?
Yeah, so what I love about being a health coach is witnessing their transformation and seeing women move from one place of pain, of fatigue, of disconnection to feeling strong, calm, and confidence in their body again. And that's really something that I can't see when I work in a clinic. And when I work in a clinic, we do really treat the physical symptoms and we treat the physical body, but we're not able to witness the transformation, the total transformation from, as I've said, pain, fatigue, disconnection to being confident and reclaiming their vitality again. So that is something very, very different from being in a clinic setting. And many women came to me, they feel frustrated because they have already tried everything. They have already been trying different exercise. They have already seen physical therapists in the clinic, and they have already tried self-care tips, but they still feel like something is missing.
Yeah.
And even though they have done all the right thing, they still say, "Oh, I don't feel like myself anymore," even though I have done all the right thing that my doctor told me or my physical therapist told me, but it's still not there. But I started working with them and I start seeing them breathe better, move with confidence, and really going back to themselves and reconnect with their body. That moment I really feel that that's really light me up.
Yeah.
And as a pelvic health coach, I get to combine my background, education in physical therapy, core exercise, and I can also add mindfulness-based therapy, going through a holistic biopsychosocial lens. That's really something that I cherish and value a lot. Um, and now I help people not just strengthen their core or pelvic floor, but really understand on a deeper level how stress, emotion, and lifestyle all influence their pain, energy, and dynamic support system.
Yeah. Do you
Yeah.
think that the reason why when people are kind of doing all the right things, and then they're just not getting those results, do you feel like it's because they're not really getting to the underlying root issues, and it's just kind of like superficial, that there's a whole other layer or two where we're getting to the root, that that's how you can unlock all of this, great transformation. That's how you're getting these excellent transformations for women. Is that the thing? Is that the thing that's missing?
Yeah, it is really the root cause of pain and root causes of symptoms. And often it is related to stress, emotion, and their uh, the environmental uh, and relationship as well. So uh, by being their health coach, I can actually explore those areas as well. And they often feel safe because they come to see me in an online setting and they were at home. They feel safe to share
Yeah.
something that is more personal, and they feel safe to tell me more beyond their symptoms. So they would often tell me how they feel, and they will also tell me of the relationship, what are the difficulties they're going through. Is it like with their kids or with their spouse or with their friends or family? So a lot of the those emotions become unlocked in this online coaching space.
Yeah. And then I love that. Thank you for sharing that, because it's not like it's just one visit. There's a continuity there, and there's a growth, and they feel safe to say that.
Yeah.
And those other things do impact, like, especially when we're talking about pelvic health, and especially in young moms, like there's a partner there usually. And then that's a whole other dynamic to take into account. Like if they're having a lot of pelvic pain, that is going to impact that relationship. And so to be able to feel safe, but then also if they're a new mom, I mean, just to get a sitter to go to the clinic and to do that, that is a big deal. Whereas if they can do it from the comfort of their own home, if they can even be nursing their baby while they're having a call with you from the comfort of their own home in a safe place, they don't have to get a sitter, go across town. You're able to help them more consistently, more deeply, dive into nutrition and breathing and all of these aspects. You mentioned a word, was it biopsychosocial? Is that what the word you use?
Yeah.
Tell us a little bit about what all that encompasses. What do you mean by that?
Yeah, so bio is our body function. It's something that we see on the outside, but the cycle, it is again the emotion, the energy level, and the stress level, or spirituality and emotional, and the social aspect is it's really their relationship with whether they are supported, whether they have yeah, a supportive spouse or supportive family, and how's the relationship with family and friends, because a lot of the moms that I see, they are isolated and they don't go out much and they just spend whole day just at home, and because they are a stay-home mom, they are a housewife, or just temporarily they have to slow down or slow down at their work, or temporarily stop working to look after their young child. And during that time, they feel very isolated and lonely. And
Yeah.
that's when health coaching really, really helped them also be more open in sharing their body as a whole rather than just looking at the bio without looking at the psycho and the social aspect of health.
Yeah, so good, Henny. Because that, you mean, even women who don't have pelvic health challenges, just being a new mom and for somebody who mainly their support system might have been at work, like they had colleagues, coworkers, people, friends, and things that they used to communicate with, and then now they're mainly at home, for example, with a baby, and the conversation is different. And I remember getting together with moms and like, oh man, like just to be able to talk to another adult was really great. And so to be able to, like, a lot of this stuff is builds up and they can't vent or release or get perspective on it, and to realize the temporary nature of some things, but then also what can we do about it rather than just feeling this awful, like, is there anything that we can do about it? And so I love that you have that approach. And I really like how online health coaching can be a great umbrella, if you will, or a great vehicle to be able to help people, uh, and in however you want to help people. What was something that you were struggling with, Henny, before you came to the Health Professional Academy? What was something that you were struggling to create as you were trying to create your own health coaching practice, and get it up and running online? What were some of the things that you were struggling with?
Yeah, before I joined the Health Professional Academy, building my own health coaching was overwhelming. And I realized that I lacked mentorship and the community of like-minded health coaches. And like knowing how to offer my valuable service with clarity and also to have that loving invitation and conversation to connect with women who need my help, it feels like a huge barrier.
Hmm.
So I want to make a real impact, but I wasn't sure how to turn my experience and turn my pelvic health into a structure and a sustainable practice that could reach women who need it the most. So this really helped me transform my practice and really bringing everything all together to serve and reach out to women who I need to reach out. And the part that I love the most is really focusing on delivering excellent results as the core missions of my practice. And when I put my energy into helping clients, everything else just fall into place.
Yeah.
And yeah, and my practice naturally attracts the right women who need my help. And when I have a structure, a practical, transformative program, then I feel more confident that I can really reach out to the women who are struggling with pelvic health challenges.
Yeah, I really love, our core philosophy is excellence is our strategy. And so when you deliver excellent results for your clients, it's a win-win. They win, you win, it becomes naturally attractive. They tell some people. And I think the other thing that I love is being able to do this in a way that's customized. And we look at, okay, what are your unique strengths? And not everybody is coming to the table with expertise, professionally, but also personally, but professionally as a pelvic health physical therapist. Not everybody has that. So I'm like, that when we have that, we're going to repurpose that knowledge and strength, because that was meaningful. And then taking your personal experience, and then how can we take all of those things, that genius that is you, extract that and package it into a way that can be of service to the women that you're meant to serve, so that we can deliver those excellent results. And also the other thing I love is that, when we talk about online and clinic, that it doesn't have to be all or none. And it's not like one's good, one's bad. And to develop, you have really a hybrid practice. And so you still are in person as a physical therapist, and that's work that is valuable and people appreciate. But then this other extension online, where you can, where you might be limited in your clinical setting with the hours and things that are available and the time that you have with them. And we can go deeper, and we can go into the nutrition and the breathing and the stress and the relationships, which probably are not really covered normally in a clinic setting. And so that it becomes very rewarding for you and rewarding for them. And so people are like, I'm not trading in my clinic practice. But what if we could do as a hybrid? What if we could do that as an add-on? And so there's many ways to do that. And I always talk about, like, looking at, where are you at? What do you want? And then who do you want to help? What is it that we're trying to create? And then customize a plan that will work for you without burning you out and sacrificing your health. Because you and I, we've both been there, done that with my medical career, burnout in that. And then, like, how can we make an even better difference, but without the burnout? How can we work smarter, not harder? And for anybody who's listening, who's a health professional, a health coach, a doctor, a physical therapist, I have a book. You can get a free copy of Six Figure Health Coach, and it talks about that 12-step blueprint to creating a business that you love, a soul satisfying practice. Okay, so the other thing, when I have an expert on the line here, I always like to talk about myths because you understand your topic more than most in your area. And so when women have these pelvic health challenges that you help them with, when they come to you, what do you think is the biggest myth when it comes to people looking to resolve their pain, their, restore their postpartum core strength and these other pelvic struggles? What are some of the myths that you see? And let's do a little myth busting here.
Yeah, so one of the biggest myths I see in they believe that the core pelvic health challenge like pain, leaks, or weakness, uh, just part of being weak or out of shape, or that the problem can fix themselves if they wait long enough. So, or many women, they just believe that healing only happens in a clinic, and they think that in clinic therapy or passive treatment is the only way that they could get support in for their healing. So, they think like they also think that pelvic health is just practicing Kegel or following a checklist of exercise progression. But all of these myths, they are only, um, everything that they believe they're only part of the whole picture. So the root causes of pelvic health challenge is so much more than just what people see on a superficial layer or what people can see or can do. Because pelvic health or pelvic health challenge that people experience are related to the dynamic system, the core control. And while the person is moving or working, walking, standing, sitting, or exercising, so it is your entire body.
Mhm.
So, and our entire body works together as a system, and we cannot separate them. So that's why I often tell clients that we have to look at your nervous system, your breathing, your movement patterns, your stress, emotion, and lifestyle.
Yeah.
Yeah, so always tell them, as you have already mentioned, Dr. Shaunna, so health coaching really bridge all the gaps that I have seen in my in clinic practice. So when I work with them in the clinic, I can only address one thing, but when I come to health coaching, I can actually address everything. And we just have this open space to talk about everything and what is affecting their dynamic system or the core control in affecting their pelvic health. So it's really rewarding for me to be in this space, and I can actually also help them to bust out the myth of believing that the problem or what they are facing, it can only be fixed in a clinic setting.
Mhm.
Um, yeah, so that really make a huge difference.
Yeah. I think, yeah, so a couple things. One, it's not that it's just weak. So what I'm hearing you say is it's not that you're just like weak muscles. It's so much more than that. And that the other myth is like that maybe that there's nothing that can be done, or that if there is, that it can only be done in the clinic. And so I think, in your case, it's a physical therapy clinic, and I see that as well with doctors or um, different therapists, where sometimes people have a belief. And I know when I was starting with my health coaching practice, as I was a doctor, and then now I was a health coach, and I remember thinking that um, I don't have my tools, I don't have my space, I don't have my receptionist. Like, how is this going to work? And so on the one, there's two types of skepticism here. One on the therapist side or the physical therapist or the doctor who is like, um, I have to see people this way. This is the only way that I can do things. But there's part of you, or at least there was part of me, and I know for you, that was really frustrated. And you're like, I know I could help people so much more. Like there's so many other things. Like they would get way better results. There was a personal trainer who was helping people, and they would help them at the gym. And she would poise the question when they were like really busting it, and they're like, okay, now if you really want to see results and are you ready to talk nutrition, come get me. Okay, well, like, why do you want to be busting it and like only getting this much results when you could get this much results with the nutrition? And so that's something that you can talk about like online or virtually, and so you can go deeper. And so I love that you've like seen that for yourself with that and you're open to that. But a lot of therapists are skeptical about that. But then it's not just the therapists that are skeptical, it's the patients themselves, the clients and the patients themselves who might be used to just doing it the same way. I think with COVID, things changed a little bit. People were more, open to online, but sometimes it was just like a clinic practice, but not on in the clinic. And so we didn't have to worry about getting parking, but they tried to just reproduce it. But in this case, it's different. Like the coaching, you're like meeting week after week, to kind of piece things together and focus for like a certain amount of time so that we can make sure that we get those excellent results. And like, when you first work with people, I know you do these initial free consults because you just really want the best for people. So I know, and we'll put at in a moment how people can get in touch with you or refer to you if they know someone who has a pelvic health challenge. Um, and I know you do those initial free virtual consults just to kind of find out about people. But when you're working with people, like what's the range of time where you would like to work with people for like how many, what length of time to really see some like amazing transformation
Yeah,
happen?
so I work with them for 12 weeks.
Yeah.
And so in this 12 weeks, I take them through a whole person approach. I combine the science-based practice, the nervous system regulation, mindfulness, and functional lifestyle strategy to really help them understand their bodies and really help them with coordination and rebuilding strength and confidence. And I really have to teach them that transformation only happens when we take a whole person approach and we are not just addressing the muscles. Even after we have addressed muscles, we have to look at your patterns and we have to look at your mindset and we have to look at what shape, how we move, and how we lift.
Yeah.
And I also want them to know that um, you know, their and their and this society tells them they that if they look good on the outside,
Yeah.
they then they must be healthy and they must be worthy. But the truth is really appearance is not the same as your body function and or your self-worth.
Hmm.
Because our body may look fine on the outside, but still struggling internally with pelvic floor dysfunction and chronic pain. But on the other hand, a body that doesn't match with what we think is or pretty or beautiful can be perfectly healthy and strong. So that's why I really help them shift their mindset and really focus on their function, not how they appear.
Yeah.
And really, we don't want them to chase after how they look. Um, and instead they are really transformed from the inside out.
Yeah.
And yeah, I want them to connect on every level from physically, emotionally, and also energetically. And really they want to be a good listener to their own body and really help the body to feel safe again and not being judged also by the society or by people around them. And I want them to really um, reclaim their confidence and also vitality.
Yeah, and the looks follow. Like, but when we just prop it up on looks, you can see that. You can see society now, like, it's, when people do the artificial things to look good but not feel good, and it's an external look, but internally they're inflamed and not healthy and poor mindset. But on the other hand, when, as you say, healthy from the inside out, when we start at the root, well, then that's easier to maintain. We don't have to keep getting getting those artificial, adjustments to kind of conform to what somebody else says that you should look like, and meanwhile not feeling great. So yeah, I love that. How have you grown, Henny, as a health coach, this whole journey of becoming a health coach and creating this business of your own? It all, you can't help but grow in the process. It's a wonderful personal development journey that we're on as we venture out to give back in this way. How have you grown through the process of becoming a health coach?
Yeah, so definitely personal growth for me. Um, it is really one of the most transformative experience of my life and something that I've never experienced or expected. Because yeah, so one of the biggest lesson is learning about how to be patient and how to have self-compassion, because without that, I cannot share it with my clients.
Yeah.
And also working with women really helped me change, like see the real change that it really doesn't come from doing more exercise,
Yeah.
but really come from being mindful and consistent and be kind to ourselves. So that would be something that is different from the traditional physical therapy practice, or doing more exercise, progress to the next level, progress to
Right.
the next level. So that is something that is very different.
Yeah.
And I also learned to really listen to myself. Uh, so tuning into myself, building a habits and that supports my own health, my mental clarity, and also help me to help other women. So yeah, so the overall process really helped me become more confident and resilient and supporting them through during their vulnerability time, and also give me a sense of, you know, reward or sense of satisfaction that I have never had before.
I love that. I love it. I mean, I think health coaching is the best career on the planet. I mean, you get to work with who you want, how you want, from where you want, when you want. It really has that freedom, and then it's a win-win. I want to just, move over into talking about, we've been talking about working more deeply with people and the case study, and like you have some case studies, examples that talk about like when you might be more limited if it was just a clinic practice, but when you can work more deeply with people, the ripple effects that happen. So, it's not just that pelvic health improves, so much else improves. Do you have, a couple of stories or case studies to share of like when you help people with one thing that you have a ripple effect and can help, and then there's so many, when you get to the root cause, all sorts of great things happen. And I think that really, I do that because I want to really encourage people to get to the root cause, because then you're not like continually putting a new band-aid on. No, we, we've gotten it. There's so much benefit here. So just share a few stories. These are my favorite part of the whole thing.
I had a client, she was 55 years old. She was a very devoted mom of two, and she is a very hardworking professional. And when we first met, she was really struggling. And she had this chronic back pain, aching joints, poor balance, weak core that made her feel like her body wasn't supporting her anymore.
Mhm.
So she told me, oh, I feel like I'm aging faster than I should. And I feel like, oh, my body is giving up on me.
Yeah.
And honestly, that feeling is very common. And because especially if she has spent years of putting everyone first
Mhm.
before her, and she's been pushing through these feelings and weakness and pain and ignoring what her body's trying to tell her. So her breakthrough came when she joined my class. So that's when things started to click for her. So she realized that her pain and weakness weren't just about her age or deconditioned body. They will also connect to her breathing pattern, her diet, her stress level, or the way she moved or didn't move throughout the day.
Hmm.
And and a lot of the time it's actually related to inactivity or lack of movement during the day. And when we start with small steps and nothing overwhelming, but she start journaling to track her progress, start practicing gentle breath work to calm her nervous system, adding small little movement here and there, doing small stretches and small walks, and also adding some mindfulness practice. She started to show herself with compassion and care. So over time, those simple changes actually transform her, and she started to feel more grounded, more support, and her pain reduced, her balance improved, and her energy came back. And she now enjoy nature walks and enjoy playful moment with her family without worrying about pain or fatigue.
I love that. So the pain, you come for the pain, but then you're able to get the pain going away, going back to nature, but then the emotional aspect as well, and the mindset is huge. So you can just kind of help people at a deeper level. And and it also highlights you don't just help people in that postpartum range, although certainly, that was kind of a big part of your own personal journey, and certainly a lot of people come, but here's someone sort of in their mid 50s who is like, "Yeah, I've got back pain." And so, and that also is part of that core. That's all part of the core that you help with. And I think that's really important to see that it's not just, sometimes we think of pelvis as just bladder and uterus, and there's more to it. There's more in that area that you help with in terms of back pain and that. Anything else that you wanted to share before we let people know how they can get in touch with you and a few of those things?
I do have another client that I would love to share. Another client I had in her late 40s during perimenopause were struggling with chronic back pain, pelvic floor weakness, and the fear that her body was falling apart.
Hmm.
And she had stopped doing yoga and hiking activities, and she felt unstable and she felt movement will make her pain worse. And
Yeah.
so she stopped all her activity that she enjoyed.
Yeah.
She worried about her posture, mobility, and she worried about whether her body will still continue to support her as she age. So age is also something that people are scared about.
Yeah.
But in our assessment, we explore every area of her health, like movement, nutrition, rest, mindset, and emotion. And then, and she finally realized that pelvic health is not just a physical issue, but it is a whole body angle instead of just one part or a specific part of muscles. And then after several weeks, and she noticed that um, she's able to move freely again. And more importantly is the emotion transformation, and she feel more confidence, and she feels age is not something that she needs to be scared about, and she can be still be actively engaged in life. And yeah, so and she can still go back to hiking, and she can still laugh without worry about leaks. And she described this as like feeling of a rebirth.
Hmm.
And yeah, so I really want people to know that pelvic health is not just something that we experience postpartum or the
Yeah.
first 1 or 2 years after baby, but it is actually something that we should address or pay attention to, uh, like even in perimenopause or menopause. So we have to support our pelvic health.
You
Yeah.
really are a pelvic health champion. And it's really important when you see how it really impacts lives, like whether it is a new mom that has so much pain she can't pick up her baby, that's huge, or pick up the groceries. That really impacts their life. Or somebody who is, maybe in their 40s who loves hiking and yoga and doing all of these things and can no longer do that. And that's significantly impacting their health. And a lot of people, like you say, pelvic health is overlooked, and a lot of people just, stop doing those things, and their life just shrinks. And I love the you're doing the work that you do. It's so meaningful. And so that people can get their lives back. They can start to move in a way that feels good and feel a way that feels good, and to get rid of that pain and to strengthen their core, and their resilience both inside and out, and that just radiates through. And I love what you're doing, Henny. And how can people reach out to you if they have a question? Obviously, you can put that in the comments if you have a question. But if people have like, hey, I have bladder leaks and I would like not have bladder leaks, how can, or any of those other challenges, how can they reach you?
Yeah, so they can visit my website, pelvichealthcoaching.com, or they can reach me through my Instagram, my name, hennying.pt wellness.
Okay, so that's pelvichealthcoaching.com. That's easy to remember. And then on Instagram, Henny, HENNIE, Ng, PT Wellness, and you can find her there. And if you are someone who's looking at, hey, maybe I should add an online component, but I don't even know where to start, I have this video here on the complete blueprint to get your online health coach practice up and running. So check that out. And with that, have a fantastic week, everyone. And thank you so much, Henny. And most of all, be good for you.